How to set and manage your goals in EQUIPP. As a pharmacist, you know the importance of achieving performance goals for your pharmacy, whether they're set by your organization, by you and your staff, or even your health plan and PBM partners. But how can you best align these goals for financial success? By using EQUIPP. EQUIPP is a data management tool for reviewing performance on medication-related quality measures with patient details which directly influence your goals. Here on the EQUIPP dashboard, you can toggle between year-to-date or 6-month measurement periods. And if you want to track historical performance, click on Select a Date Range. EQUIPP defaults to a year-to-date view, aligning with most health plan programs, which evaluate performance on a calendar year measurement period. This allows you to track your yearly performance goals and evaluate patient performance and quality measures more accurately. Now, let's dive in on a specific measure. Click the measure name, like cholesterol PDC, to access the measure performance screen. Let's review the benchmarks, which is a comparison tool to review your performance against peers for the same measure. Most importantly, you can compare your pharmacy against others serving a health plan population. Some health plan programs use this level of evaluation for reimbursement. Now, what about your network or program goals? A pharmacy's program-based goals are set by the health plan program and are right here in the EQUIPP table. Programs with the highest patient counts are prioritized first. Here's a tip. Focus on programs with the largest patient attribution to maximize your reimbursement opportunity. You can sort any column here to direct your efforts in the best way. The color-coded icons in the table should be used for performance guidance. Green checks next to the program name indicate the goal has been met, along with the green thumbs up in the gap column. A red thumbs down means you have not met the program goal and displays the percentage gap needed to close so you can achieve the program expected goal. Each program will display the square and arrow icon, which navigates to the patients impacting the specific program in the indicated measure. Here's another tip. If your goal is to improve your overall performance score, your pharmacy should consider setting a goal to prioritize these patients based on those closest to achieving the measure. Once you identify your primary areas of focus, identify the individual patients with those plans using the Outliers feature. Establishing the performance goals with your pharmacy staff and leveraging EQUIPP to track progress is your path to success. Check your measure performance monthly, review the patient data, which may be updated weekly, and create an action plan to meet payer program expectations to meet your goals. Create your path to pharmacy performance. Gather your team and log into equipp.pharmacyquality.com today.